Be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video. The human body is a complex and intricate system governed by numerous regulatory mechanisms. One such system that plays a vital role in maintaining homeostasis and responding to stressors is the sympathetic nervous system, SNS. The SNS is responsible for the fight or flight response, enabling the body to adapt to various stressors. At the heart of this system lie endogenous adrenergic agonists, a class of molecules that bind to adrenergic receptors, initiating a cascade of physiological responses. This essay explores the fundamental aspects of endogenous adrenergic agonists, their classification, mechanisms of action, and their profound impact on human health. Endogenous adrenergic agonists. An overview. Endogenous adrenergic agonists are molecules produced within the body that activate adrenergic receptors. These receptors are primarily found in various tissues and organs, including the heart, blood vessels, lungs, and certain glands. The two main types of adrenergic receptors are alpha-adrenergic receptors and beta-adrenergic receptors, each linked to distinct physiological responses. Endogenous adrenergic agonists are classified into two main categories: catecholamines and non-catecholamines. Catecholamines. Catecholamines are a class of endogenous adrenergic agonists that contain a catechol ring structure. The three primary catecholamines are epinephrine, adrenaline, norepinephrine, noradrenaline, and dopamine. These molecules are synthesized in specialized cells of the adrenal medulla and nerve terminals of sympathetic neurons. Epinephrine and norepinephrine play crucial roles in the fight or flight response by increasing heart rate, dilating airways, and diverting blood flow to vital organs. Dopamine, in addition to its role in the SNS, also functions as a neurotransmitter involved in motivation and reward. Non-catecholamines. Non-catecholamines, such as thyroid hormones and histamine, are also endogenous adrenergic agonists. Although they do not possess the catechol ring structure, they activate adrenergic receptors and contribute to various physiological processes. Thyroid hormones modulate metabolic rate and influence cardiovascular function, while histamine plays a role in immune responses, gastric acid secretion, and vasodilation. Mechanisms of action. Endogenous adrenergic agonists exert their effects by binding to adrenergic receptors on target cells. This interaction triggers a series of intracellular events through second messenger systems. For beta-adrenergic receptors, activation stimulates the production of cyclic adenosine monophosphate, CAMP, leading to various downstream effects such as enhanced contractility in the heart and relaxation of smooth muscles. Alpha-adrenergic receptors, on the other hand, mediate vasoconstriction and other sympathetic responses through mechanisms involving intracellular calcium signaling. Clinical significance. The significance of endogenous adrenergic agonists extends to numerous clinical applications. For instance, epinephrine is used in emergency situations such as anaphylaxis to rapidly increase heart rate, reverse bronchoconstriction, and restore blood pressure. Norepinephrine is commonly administered in cases of hypotension to enhance systemic vascular resistance. Beta-adrenergic agonists like isoproterenol are employed to treat bradycardia and heart block, while beta blockers act as antagonists to manage hypertension, angina, and arrhythmias. Conclusion. Endogenous adrenergic agonists are pivotal components of the sympathetic nervous system, orchestrating responses crucial for survival and adaptation. Their diverse roles, mechanisms of action, and clinical applications underscore their importance in maintaining physiological equilibrium. A comprehensive understanding of these molecules provides insights into the intricate workings of the human body and offers avenues for developing targeted therapeutic interventions for a range of medical conditions.